If there's no pain, how long should I wait to have a revision for a loose tibial prosthesis? And is damage occurring even though there is no pain? So to start, I think it's essential to figure out what the etiology of the pain is, or the loosening. So in this case, the first thing you have to do unequivocally is rule out infection. So you would need to come in, you'd need to be seen, we would draw labs, we would probably aspirate fluid out of the joint and send that for evaluation to make sure that the loosening isn't a result of an infection, because that's treated very differently. Assuming there's no infection and you have a loose tibial prosthesis that's aseptic and you're not having any pain, that's a different story. Then we need to start really thinking about the patient. So in general, you would talk about revising that prosthesis. You would have to know the type of prosthesis. So in a traditional sort of cemented prosthesis, if it's debonded at the implant cement interface or the cement bone interface, the probability that that's going to heal is very low. In a cementless implant, so it's just the implant on the bone itself, it may be a little bit different, but that's a much less common prosthesis used right now. So I think if it's a young, active patient, you talk to them about doing revision, whether it's symptomatic or not. If it's an older patient, a debilitated patient, if it's someone who is not ambulatory, for example, then you'd have a conversation with them and the family about what the goals are and the expectations. It's not miraculously going to heal back down. The cement's not going to cure all of a sudden in that patient. But if they're functional and they're not having pain and they're living the sort of reasonable lifestyle that they're living, I think it's reasonable to watch it and follow up with them radiographically and clinically.